Doctors of Reddit, what happened when you diagnosed a COVID-19 denier with COVID-19? Aiku nurse here, 6 years. Dealt with COVID since March 2020. Actually had the first confirmed PT at our hospital. February was rough. I had a 2-week streak where every day 1 or 2 of my patients would die. We'd go up to 3 or 4 patient assignments. The norm is 2, 1 or 1 if on certain equipment. Most all of the patients understood the severity of what they had. A handful didn't believe they had COVID, even though removing high flow O2 or their BiPAP would put their sats down into the 60s or 70s. Many had comorbidities that put them at risk. COPD, asthma, obesity, sleep apnea, smoking. I think people would refuse to be intubated because they knew what the outcome would be. Fight, hope, pray, fingers crossed, whatever you want to call it, delaying the inevitable. Our ICU attending would actually have them sign consent for intubation, if they were cognizant enough to do so. Almost all of them died. Very few made it out alive but still so sick and debilitated, some with trachea. One guy in particular sticks out. This was right after Christmas. 21 years old, HXDM1, obesity, sleep apnea, didn't like to take his insulin, admitted with COVID. Didn't believe he had it. Should have been tubed days before but refused. Then he ended up being intubated emergently. Took about 5 of us to prone him. Lay him on his stomach. Because his O2 sats were in the 60s. Couldn't get a pulse. Noticed no waveform on the outline. Had to flip him back over to do CPR for about an hour or so before we called it. Had a kid and a fiancé. Honestly, it was more of the families that denied their loved one had COVID. Upset, understandably, about not being able to visit. Zoom calls just don't cut it. I say this all as my parents, mom SD and dad SM, are all COVID deniers, even when I tell them what it's like. Well, those people had other things wrong with them though. They were older, they tell me. They send me links about all the conspiracy theories COVID. I got the Moderna in December and January. Still haven't told them. It's awful. The facial swelling alone from being prone is enough to give a person nightmares. Watching someone go into multi-system organ failure, needing dialysis, unable to put them back onto their back, being maxed out on ventilator settings and that still not being enough to the point of barotrauma and collapsing a lung and needing a chest tube to reinflate it. Families saying do everything even though they had coded once or twice. Hearing families on Zoom crying, praying, singing as the patient is intubated, sedated, and paralyzed so the ventilator can do the work. Tearing up under all the PPE because we are still human. We work so hard and sometimes it doesn't freaking matter. But we go back, day after day. I wish people who don't believe could see what I have seen. It might scare them enough to take precautions seriously and get the vaccine. I'm so sorry to hear you're going through the skepticism from families and your own family. On top of everything else, get some therapy if you can. It's so important for healthcare workers who've been through a trauma like this. Hugs if wanted. IQ covered. IQ charge nurse here. Had a woman trial leaving the ER against medical advice with COVID and was needing tons of O2. Our docs convinced her to get admitted. My wife was a nurse and brought her up to me. Patient was yelling and screaming, ripping off her mask, spitting and telling us we're all sheep between gasping for breath. Our docs told her she was close to needing to be intubated, breathing tube, and she just scoffed. We reached out to the husband who proceeded to swear and berate us, telling us we're keeping her prisoner, no visitors in our COVID unit, and that we can do whatever we need because none of this is real and it's all for show so you guys can get paid. She gets intubated, decompensates over the next few days, and finally codes. We code, perform CPR, give medications, defibrillate, etc. her for well over 1.5 hours before calling her time of death. The kicker was calling her husband and getting absolutely excoriated because we injected her with COVID as an experiment and killed her. He then had to be escorted out of the hospital when he came in to try getting up to the unit, without a mask, of course. This crap's getting exhausting. One story stands out. Last summer a guy came to the ED with symptoms and tested positive. He refused admission for the classic list of reasons. It's a complete hoax. And even if it's not a complete hoax, it's not that big a deal. I'm strong enough, etc. Couple days later he was back in the ED with his mom. who he lived with and who was now also symptomatic. They were both admitted and eventually put on ventilators. Guy lived, but his mom didn't. Dude killed his mom. I can't imagine how you live with that. Nurse here. I had COVID and now I am in rehabilitation because my lungs are at 70% capacity. Now, I was at 40% capacity and now when I hear someone say that, I have the urge to slap them with a chair. I will need another year until I am fully recovered. Not a doctor, but my cousin-in-law was a COVID denier. Went to his COVID denier girlfriend's family house for Thanksgiving without telling his parents that they were COVID deniers. He was living with his parents, my wife's aunt and uncle, since he had recently divorced his wife. Got back and found out a week later that the whole girlfriend's family tested positive. He got it, so his parents both got it. His mother was in treatment for breast cancer and his dad had asthma BTW and they are not COVID deniers. His mother recovered, but his dad, my wife's uncle, went from coughing and wheezing the day after Christmas to the on New Year's Day. Within 24 hours after that he was put on a ventilator. 3 weeks later he passed. So yeah, my COVID denier cousin-in-law effectively killed my wife's uncle and now that whole part of the family is really tense as his brothers kinda blame him for killing their dad but their mom, wife's aunt, isn't willing to blame her son. Frick COVID deniers. It's not really a joke. These buttholes are literally killing people through gross negligence and idiocy. My mother killed my aunt, her own sister, who was at risk, just to prove a point about COVID supposedly being a hoax. It's the second relative that my mother killed. Now, mom thinks very highly of herself. She is very religious and believes she belongs in heaven and that I am a heathen for being gay. Sure, I love someone of the same sex as me, but at least I didn't kill 2 people. As an anesthesiologist, by the time someone's calling for us it's for intubation and the patient is in no condition to deny anything. Honestly, it's usually the family that's the issue and that needs to be escorted from the room. My mom works for an OBGYN who specializes in high-risk pregnancies and births, and he was called into the hospital to check out a woman whose due date was about 2 weeks away and who was very sick. He confirmed she had COVID and admitted her to the hospital until she gave birth, but she insisted it was a hoax and ended up checking herself out AMA, but not before she spat in the face of the nurse, who coincidentally had just completed chemo. That was near the beginning of the pandemic, and I'm so curious what happened to that lady. The nurse is okay, thank goodness. That is at least assault, but possibly so much more depending on the outcome. I'm a student, funeral director and I see families go to the funeral of someone who died of COVID-19 and still deny it. They started out shrieking at the doctors to change the cause of death on the death certificate. Now FEMA is helping with funeral expenses for COVID deaths. Suddenly there's changes of heart. They just kept denying they had it, stated they had something else, and tried to leave against medical advice while on high-flow nasal cannula, which we didn't let him do because he would have died within minutes. Before he was admitted to the hospital, he was symptomatic but refused to isolate at home. He gave it to his wife who ended up in the ICU. I'm a doctor working in acute internal medicine. I've seen lots of COVID over the last 12 months, probably 300 plus cases. The one that sticks out in my mind the most was a 70-year-old lady with COPD. She refused to have a vaccine because she didn't trust it despite the fact she was eligible for one 4 weeks beforehand. In the UK, subsequently caught COVID and was admitted to hospital. She repeatedly doubted this was the diagnosis. She refused to go to our COVID high dependency unit despite quite significant respiratory failure. Of course she deteriorated over a number of days to the point where she was on maximal oxygen on the ward and at that point finally accepted treatment in HDU with high flow oxygen, although continued to doubt she had COVID. Died within 24 hours of her HDU admission, having refused to go to ICU. And of course, what did her family say? They were convinced she never had COVID and even went as far as accusing us of withholding life-saving treatment from her. Unfortunately, there's no treatment for stupidity. I work with a denier with COPD, mid-60s, no masks, refused the injection, etc. It blows my mind that she hasn't caught it. The worst thing is we have 2 immunocompromised people on the same floor as her. My wife's a nurse, just had to deal with a patient who refused to get tested prior to her surgery, so they had to treat her like a COVID patient and needed to charge her for all the added PPE like gowns, goggles, etc. The kicker is, recovery wouldn't take her for observation while she was woken up, so the anesthesiologist needed to stay and monitor her in the room for nearly 3 hours. They are billed at $400 15 minutes, and there is no way her insurance is going to cover the extra cost because she signed a document saying she denied a COVID test. $4,800 extra for the anesthesiologist. Didn't diagnose a denier, so not exactly this, but did have a patient refuse testing upon admission and aggressively yelling COVID is a hoax. I calmly said, okay, nurse, since we won't know his status, please admit him to the COVID floor. He became a believer in an instant and requested to be tested. So basically he never really doubted the virus and just thought his own risk of catching it was low, and frick everyone else. Not a doctor, but one of my university friends is a nurse in a COVID ward and has been since April 2020. She said she's lost count of how many people she's seen die while still denying COVID is real, or their families freak out at the healthcare workers and claim they are setting this up for the media. Super bizarre. One woman tested positive but had mild symptoms. Because of her age and some other health issues, they wanted to put her on oxygen early as a precautionary measure. She refused and went home. She came back and less than 24 hours later super sick and unable to breathe. She said somebody must have injected her with chemicals from a Wuhan lab while she was at the hospital the day prior. But then she also said it was fake. Not sure how that works out. Anyway, she kept carrying on about how God was just allowing Satan to test her faith and she would remain in the hospital but not allow treatment. She allowed a saline IV, and then removed it and claimed it was full of vaccine tests to eradicate white people. Then she demanded her family be allowed into the hospital and COVID ward without a mask. This carried on as she got sicker and sicker over about 48 hours, before she slipped out of consciousness. The last words she said to my friend were, "You'll burn in heck for your part in this." She also had a story about a guy who had COVID twice and was in the hospital for over 3 months during 2021. When the time period had passed since his second battle, she recommended he get the vaccine since he was clearly very susceptible to it. Keep in mind the first time he had it was mild, so he was still going around everywhere to bars and out to eat. Places never closed here. It's super conservative. Without a mask, who knows how many people he passed it to. Anyway, his reply to her suggestion was, "Now why the frick would I want to let those goddamn Chinese track me like that? I won't get something that isn't real. You almost died." It would be so hard to resist telling the lady that God gave you COVID as punishment for not following his commandments as a retort. What a piece of work. My worst experience was when a 2-year-old kid got diagnosed with COVID. His mother had brought him with care of fever and diarrhea. The child was severely dehydrated and so we had to do a mandatory swab test since we planned to admit him. It came positive and the mother refused to admit it. We were ready to perform a repeat test and we even advised for the parents to get tested. Her defense was the child never left the house. It's just I and the father who go to work daily. The grandmother babysits while we are away. How can he even get COVID without leaving the house? She had called her husband. He came with 10-15 relatives in a car. They broke a few chairs and then left with the baby. We just informed about the case to the COVID control center. Not a doctor, but nurse that worked in one of our COVID ICUs. Lady was intubated, sedated, proned. Therapy that involves lying the patient on their stomach in order to oxygenate the lung more effectively. Reserved for very sick COVID patients. The whole shebang. Miraculously she recovers and is weaned down to high-flow nasal cannula. Still a fairly high oxygen requirement, but better than needing the breathing tube. This spiteful she-devil would purposely cough on us nurses as we went into her room to give meds care, simultaneously yelling that COVID isn't real and that we gave her COVID. God, this winter sucked. Not a doctor, but when my grandmother was dying, my relatives kept pushing me and the doctors to say what it really was. It added so much stress to an already difficult situation and was embarrassing as well. Even after she died, they kept saying things like, "What if it was a stroke and she was misdiagnosed?" Don't you think they just didn't want to help her? I was trying to arrange with hospice to go in and say goodbye and my stupid second cousin was sending me YouTube videos about how COVID is fake. I was already not close with these people and I am glad they are out of my life now. I'm a family doc who mostly does outpatient. I live in a pretty conservative area with a good proportion of COVID deniers, so I've been seeing COVID deniers since this mess became politicized. I've lost a few patients over the mask mandate. Anyway, I'm pretty pleased to say that several of my COVID denying patients have completely turned their attitude around when they, or a close family member, contracted COVID. Even if their case wasn't severe, the sudden terror that they could wind up on a ventilator overnight really puts the fear of God into people. Unfortunately, I still have some patients who are still pretty obnoxious despite their COVID diagnosis. They mostly dig in deeper into paranoia, if not about the virus itself, then about the circumstances surrounding them contracting it. If OC had done his job from the beginning, it never would have hit this town. It's the entire fault of Obamacare that I can't get the experimental immunoglobulin treatment. It's not. Your eligibility for the infusion is dependent on a list of risk factors. And, probably my favorite, so I have COVID and it's completely your responsibility to fix it. I need you to send hydroxychloroquine, zinc, Vit-D, lisinopril and azithromycin to the pharmacy. Then they proceed to get pee at me when I don't. And yes, each of those things were actual things patients said to me after getting their diagnosis. I could probably think of more, but those were the most memorable ones. Family members have come in with a sick family member and lied about exposure and or symptoms, despite a member's testing positive. This has led to inappropriate management, delay in treatment, and exposure of staff and other families. The family members then get angry when told to isolate. Reading some of these stories are wild. Even at the brink of death, people still refuse that COVID is real or that they have it. They would rather believe anything else, almost to a point that I feel a doctor could tell them they are dying of AIDS or some made up disease and they go, oh see, I knew it wasn't COVID. Not a doctor, but my wife is and a few of our family friends are as well. One of them is sports medicine family. The guy came in, refused to use a mask. Our friend refused to treat him until he masked up. He had a newborn at the time too. When our friend told him he most likely has COVID, he needs to go to Tampa General immediately for testing and treatment, the guy said no, it's fake, he just needed some antibiotics. He left without getting a prescription, called back that night, demanded to be given oxygen. Our friend told him his only option was to go to the hospital. Guy had a severe case of COVID and ended up being hospitalized for a few weeks. He still thinks it was fake and was only a severe flu. Still had to treat her despite her accusing me of hiding the real diagnosis from her and doing something to make her sicker. Love my job. I can't fathom that people really believe that in a pandemic their likelihood of having COVID is so low that they accuse people of hiding a diagnosis. Makes no sense to me. I'm an attending physician at our trade unit. On a Friday, an older gentleman, 60 and years, came in with his entire family, wife, sister, Bill, 2 youths and 3 children, none of them with a face mask. All had mild COVID symptoms except him. He was saturating 80% with evident shortness of breath. We insisted in doing PCR and a chest CAT scan looking for COVID, but he and his wife refused, saying that COVID wasn't real and it was just a bacterial infection. The more we talked with him, the more agitated he got, to the point that his face was red. We suggested hospitalizing him to stabilize him and start treatment, but they accused us of exaggerating his symptoms and that we only wanted to hospitalize him so we could steal the liquid in his knees. A stupid rumor that was going around when this whole thing started. They both cursed at us and said they were going to a better hospital to get antibiotics. Fast forward 24 hours later, on Saturday, we get a call from the hospital next county over telling us that they intubated one of our patients because he went into respiratory failure when he arrived and they had to transfer him here because they don't have the appropriate equipment. We transfer the patient on Sunday only to find out on the CAT scan he had 90% of lung damage. He passed away on Monday morning. Just before the family took the body away, I gave the widow the death certificate that I filled out, and before walking away, she turns around and waves the certificate yelling, "See, I told you it wasn't COVID. It says here, death due to pulmonary pneumonia due to SARS-CoV-2. I knew it was a bacteria. I told her, SARS-CoV-2 is COVID-19, Mom." It's difficult to argue with a genius, but it's impossible to argue with an idiot. I'm an anesthesiologist, and in our institution, We're the ones tasked with intubating COVID suspects positive patients who would otherwise die without ventilatory support. And holy heck, there are a lot of patients who don't believe COVID is real. Most of them believe that it's just an elaborate lie that doctors use to label random patients to mooch money off them. Some of them scream at us in whatever capacity their diseased lungs can allow them to. Some outright refuse intubation, in which case they die several hours later from respiratory failure. It's emotionally taxing having to face that every shift. I'm an emergency depth physician in the US. I work in an area that had the highest death rate for a solid couple weeks in the country. During our peak time when we had national news crews here covering how we were a shit show, saw numerous people screaming their COVID disease wasn't real despite being hypoxic and on large amounts of oxygen due to COVID. That was an unpleasant time as this was still early, May-June, and it was extremely political, like people apparently plotting to kidnap our state governor due to lockdowns. Saw a lot of people refusing COVID testing who needed admission for non-COVID purposes because the swabs would give them COVID or put some sort of tracking device. They weren't pleased when they then had to be admitted to our full-blown COVID floors. Our COVID floors resembled a war zone because they were understaffed and relative crap hole conditions as we basically converted hallways into COVID floors. Also saw a lot of people, young people who weren't exactly deniers but thought you basically couldn't sick if you were young. Lots of people with their lungs permanently scarred or at a minimum a couple weeks of misery and or spread it to their loved ones who got extremely ill. That last point. I am early 40s. I wonder how many people my age will be dying early in 20-30 years from the long-term damage that a mild case of COVID did to their lungs and or body. RN here with most of 2020 spent in COVID land. I never had anyone refuse treatment when things got serious. I know some of the MDs I worked with got yelled at, like the rest of us, but honestly that happens frequently anyway. Some denier patients lived, many of which had accepted reality by the end of their stay after seeing what we all were going through to treat them. Some died telling me I was a sheep or an idiot or a liar between gasps of air. COVID didn't care. Imagine your last words are calling the guy trying to save your life a liar. I work on a COVID unit and I ran into a patient like this. They'd tell me over and over again about how they weren't really sick and about how I didn't need to be gowned up in PPE. They even tried to take my face shield off. If you test positive for COVID 2 times then you have COVID. People are crazy. They even tried to take my face shield off. That is beyond crazy emo. Be nuts all to yourself. Don't freaking touch others, you psycho. I had a lady who was maxed out on high flow, next step is breathing tube, who still refused she had COVID and was holding a negative test in her hand that she had taken a week prior. The COVID equivalent of the Black Knight from Monty Python and the Holy Grail. I'm an ODP and work alongside anesthetists in theaters and ICU. To be honest, I've not really seen anything from patients regarding outright denial. However, I have seen some of my friends on Facebook who have spouted all sorts of lies. That's really disappointing to say the least. One of them, a friend of my wife, works at the hospital. She works in admin and refuses to wear a mask and even bought some certificate off the net so she doesn't have to wear one in public. Anyway, that's being escalated up the chain of disciplinary action. If you have such a bad respiratory issue that you can't wear a mask, then maybe you should stay home. I swear these people pee me off so bad. I hope she gets appropriate punishment for her refusal. I have treated a young male in our ICU with critical COVID-19 with severe diabetic ketoacidosis. He did not believe in insulin. Yes, you are reading this right, or other anti-diabetics. Even though insulin is inexpensive in our country, he tried to treat his type 2 diabetes with herbs. His HbA1c, the lab value showing the state of his diabetes on the longer run, was off the roof. He did not vaccinate, he was offered, did not wear a mask, did not distance, and did not believe in any of this corona bullshit. Most of this information was obtained from his 20-year-old daughter, as he was quite disoriented at presentation and was intubated urgently. She was sobbing through the phone every day for 1.5 months until he died. I held the phone with his daughter on call to his ears multiple times when he was still intubated, but his mind cleared up and his sedation was optimal. I was quite convinced that he realized his mistake on the ventilator, with lines and tubes inserted into his body everywhere, and in his last clear moments, when his mind allowed, but I cannot be absolutely sure. I often think about the last conversation and last mental images people have before their death. Not a doctor but work in the psych area of the emergency department. Needless to say, there's a lot of psychiatric illness based COVID denial and or paranoia. Patients often refuse swabs thinking we are trying to implant microchips. I only bring up my experience to contrast my psychiatrically unwell COVID denying patients to the psychologically unfit COVID denying population. One is because of brain chemical imbalances and the other due to propaganda, politicization, and poor critical thinking skills. It's interesting that the outcomes are similar, if only in this respect. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.